Hello students, welcome to the today's topic of lecture, that is Emulsion. I am Anisha Chakraborty, Assistant Professor of Bengal School of Technology, hereby welcome you all to the world of pharmacy with this topic. Emulsion is an example of biphasic liquid dosage form. From the word biphasic, you might have guessed that it contains two naturally immiscible phases inside their formulation. Emulsion and suspension are examples of biphasic liquid dosage form, where emulsion contains two naturally immiscible liquids such as water and oil mixed together and stabilized with the help of another third ingredient called as emulsifying agent or emulsifier, while suspension contains a immiscible solid along with another immiscible solid, liquid or gas inside their formulation. Today's focus of discussion is emulsion. Like all other pharmaceutical formulation, ideally emulsion should be free from any contamination. It should be non-toxic, non-irritant and stable. All the ingredients used in formulation of emulsion should be compatible with each other. There are some advantages of emulsion. That is, they are easy to swallow, they are suitable for patients of all age groups such as infants to geriatric patients also. It is cost effective and large scale production of emulsion is also possible. There are a few disadvantages of emulsion. It is not suitable for unconscious patients as we generally administer it orally. It also cannot avoid fast metabolism. There are a few stability problems of emulsion which we'll be discussing in future lectures. Today's topic is mainly definition, classification and identification of different types of emulsion. As I have already told you, it is a thermodynamically unstable formulation as it contains two immiscible liquid phases. Between the two immiscible liquid phases, one of which is dispersed as small little globules onto the other liquid phase, is called as dispersed phase or internal phase, while the other liquid is called as continuous or external phase. We can see it in the picture presented on the screen clearly that which type of liquid used as the internal phase and external phase will determine what type of emulsion we have prepared. If oil is present in the formulation as small little globules and disperse themselves onto water, then the oil in this case is called as internal or dispersed phase, while the water is called as the continuous phase. That means here we have prepared O by W emulsion, that is oil in water emulsion. In the second picture you can see the water molecules over here is dispersed as small globules onto the oil phase. So here we have prepared water in oil emulsion. That means water globules are distributed onto the oil phase. So now let us dive deeper into the classification of emulsion. Emulsion on the basis of dispersion method, as we have been discussing, are classified into three main categories, that is O by W or oil in water emulsion, W by O or water in oil emulsion, and multiple emulsion, that is O by W by O and W by O by W. The oil in water emulsion and water in oil emulsion are also called primary emulsion, as it contains one single internal phase, while multiple phase emulsion are also called as secondary emulsion, as it contains two internal phases, such as oil in water or water in oil. On the basis of droplet size, also emulsion can be classified in three different categories, that is mini emulsion, micro emulsion and nano emulsion. For nano emulsion, the droplet size of emulsion should be below 100 nanometer. For micro emulsion, it is in between 100 to 60 nanometer. For mini emulsion, the droplet size should be 0.1 to 10 micrometer only, while the macro emulsion contains globule sizes of 0.2 to 100 millimeters. Now comes a very important topic in this discussion. What is the basic difference between this oil in water emulsion and water in oil emulsion? These questions comes towards you very frequently in your semester exam also, and it is very much important for our basic understanding. In oil in water emulsion, water is the dispersion medium and oil is in the dispersed phase. That means the oil globules are dispersed onto the water phase. Whereas in water in oil emulsion, oil is in the dispersion medium or continuous phase and the water globules are dispersed in the oil phase. All the water soluble drugs are more quickly released from oil in water emulsion, as water is present as the continuous phase in this formulation. It means the content or amount of water present in this formulation will be greater than water in oil emulsion. Similarly, oil-soluble drugs are more quickly released from water in oil emulsion, as the amount of oil present in this formulation is greater and the oil is also present as continuous phase over here. Oil in water emulsion are preferred for internal use. It means it is preferred to be taken orally, while water in oil emulsion are preferred formulations for external use. We generally use it on skin. Oil in water emulsion are non-greasy in nature and water in oil emulsion are quite greasy to be applied. Oil in water emulsion also gives a positive response for conductivity test, as water is in external phase and we all know that water is quite a good conductor of electricity, while oil being a very poor conductor of electricity. W by O, that is water in oil emulsion, give a negative response to the conductivity test. We can also use this electrical conductivity test to identify an unknown. Now, let us discuss about a interesting topic, that is identification of different types of emulsion. If you are given with an unknown sample of emulsion and asked to identify what type of emulsion it is. Then you have to use one of these methods to determine the type of emulsion presented to you, as just using our naked eyes and differentiate between W by O or O by W emulsion is quite difficult. The first method of detection of emulsion type is the dilution test. It is a very easy test and can be done in a few steps only. If we add a few drops of water into the unknown sample and see that the sample is easily diluted, that is, the water is distributed uniformly in the formulation, that we can easily infer that water is present as continuous phase in this formulation. That means the formulation is O by W type of formulation. But if the added water is separated out as another layer, then we can infer that not water but oil is presented as continuous phase in the formulation. That means the formulation is W by O type of emulsion, as we need to add oil to dilute W by O type of emulsion further. Next comes the dye test or dye solubility test. Here we can mix a water soluble type of dye such as amaranth, which gives red color or scarlet color. Mix it with the emulsion sample given to us and observe it under microscope. If the continuous phase of the formulation appears red, then it is O by W emulsion. And if the globules or the dispersed phase of the formulation appears red and the continuous phase is colorless, then we can infer that the unknown sample is W by O type of emulsion. Similarly, if we use oil soluble dye such as scarlet red, which also appears red in color and is added to the emulsion and observed under microscope, here we will be seeing that the continuous phase appears red, then we'll be inferring that the unknown sample is W by O type of emulsion. Whereas if the globules appear red and the continuous phase is colorless, then it will be O by W type of emulsion, as the dye we have used, if water soluble, it will be mixed with the phase which contains water, and if the dye is oil soluble, then it will be mixed with the phase that is oil in the formulation. Next comes the water conductivity test, which was already discussed a little bit in the difference between water in oil and oil in water emulsion. What we need to do is we need to place the emulsion sample in a beaker and add a pair of electrode which is connected to the electric bulb and immerse it or dip it into the emulsion. If the bulb glows, then it will be obviously oil in water emulsion, as water is the good conductor of electricity. But if the sample is water in oil type of emulsion, then the bulb will not glow, as water cannot conduct electricity. The last test we can use is the fluorescence test, where oil where we place the emulsion sample under UV light and the oil gives fluorescence and the water does not. So, if the emulsion is O by W type of emulsion, then it will show as a spotty pattern. It means the oil globules only give you the fluorescent effect. But in case of W by O emulsion, the background or the total emulsion will glow as fluorescent as oil is in the continuous phase of the formulation. So we have already covered quite a few topics in today's video. Lastly, I want to tell you about the different types of pharmaceutical emulsion. We can use emulsion as lotions, liniment creams, ointments, and vitamin drops for the use of patients. Now, if you have any queries regarding the topics discussed in today's lecture, please mention it in the comment below. And I have a question for you. If you know the answer, please also comment it below. Do you know an example of biphasic liquid dosage form which is other than emulsion? If you know it, please mention below. Thank you for your patience and listening to the video. Hope we can also discuss such topics in future. Thank you. Thanks to all.